So, the Caregiver Support Program of the Dementia Care Collaborative was started in 2017. We are part of the Palliative Care and Geriatric Medicine Division. And as many of you know, the mission of our program is to transform memory care. We exist at MGH to educate, connect, and support. Kind of say it's our trifecta mission. And this is for patients, for caregivers, for clinicians, and for the community. We offer care consultations to caregivers and patients in specific MGH clinics. We offer skills classes for caregivers. We offer support groups. We offer these health and resiliency programs. And this program, as some of you have asked, is entirely funded through philanthropic support. So if you are interested in learning how to support the program, always feel free to reach out to me, to Susan, to Judy, to Barbara, to anyone on our team. And often with all the invitations, there's a little button at the bottom that says Support the Dementia Care Collaborative. So I would like to now introduce Irene. So Irene Martyniuk is our phenomenal presenter today. She is a licensed acupuncturist, and she is the co-director of the Katherine A. Gallagher Integrative Therapy Program at MGH Cancer Center. Everybody here at MGH has a long title. Her clinical work focuses on optimizing symptom management for patients and providing education to the patient and caregivers. So that's kind of the credentialing background of Irene. And I also learned yesterday that she is a polar plunger. She loves cold water swims, which I find really interesting and fascinating. There's a lot of documentation coming out about how that can help with depression and anxiety. And after she's done polar plunging at Plum Island, she's got a menagerie of 3 kitties and a dog. And we found out yesterday we have something in common, that she has 2 cats that are Manx without tails, and I have a Manx too. So I'm always liking to find a little nugget of information about people that isn't necessarily about their work. So I am going to turn it over to Irene. Thank you so much, Irene, for being here.
Thank you. Thank you. And everyone can hear me okay? Yes, good, excellent. So I'm delighted to be here with you today and wanted to just preface the program with a pause and an acknowledgement that as caregivers, you are probably rushing from something to get here, and that in your mind, in some portion of your mind, you're thinking about the next thing you have to do after you get off this call. And that for the next 30 minutes, 35 minutes, I'd like you to try to have your head where your body is. And it's probably one of the most difficult things to do when your to-do list is as long as I'd imagine your to-do lists are. So the way that one of the things I find helpful to do to get connected to where my head and body are is to just put a hand on my heart or on my belly, just to acknowledge that I'm here and that I'm worthy, and that the ability to take a pause in the midst of difficult times is a gift we give to ourselves. As Nori is saying, it's a gift we give ourselves that allows us to be present for ourselves and for the people we care about. So I'm going to invite you to close your eyes if you'd like, or not, and just take 10 seconds to get fully in the room, feel your sits bones, feel where you're sitting, feel where your feet are, and then we'll get started. So just 10 seconds. And thank you. So the techniques that I'm going to share with you today are things that you can do at any point during the course of the day. And they are gentle massage and acupressure techniques that you can do for a short period of time if you have You could even do it when you're sitting on the toilet or washing your face. If you have a short period of time, or if you have, say, 15 or 20 minutes that you kind of dedicate for self-care time. I'm going to share my screen briefly because there's some anatomical landmarks I want to share with you and some diagrams that will show what parts of the face and the head that you'll be massaging. Now, this initial portion is for you to do for yourself. And as you'll see from the diagrams, the head, the face, the neck, the top of the shoulders are just loaded with nerves, interconnected muscles, the fascia, the connective tissue are all very intertwined. But there are some very key landmarks that we all have. And those are the points where, for many people, you hold tension, whether it's the jaw, around the eyes, the forehead. And I'm just going to show you some points that you can apply a little bit of gentle pressure to help alleviate some of that tension. So I'm just going to share my screen. And this is the correct one. Yes, this is the correct one. Yes, from beginning. Oh, wrong way. There we go. Yes. Okay, here we are. That's who I am. I don't have any disclosures other than that I have 3 cats and a dog. And everyone is calm at the moment, but I have no guarantees that that will continue. So, so I just wanted to give you fair warning. So this is what we're going to kind of focus on, the face and adjacent areas. I'm going to give you, think about your face and your head and your neck as a trail, and that there are different points along the trail. They're going to be landmarks, just like any kind of trail that you might hike. And those are going to be the places you'll return to apply acupressure for self-care. And then I'm going to take a brief digression and talk about creating an environment that engages all of your senses for self-care. So we're going to be focusing on touch, but in addition, you might want to incorporate music. I know my colleague, Hannah Shefsky, was here a few weeks ago and talked about using music to help to create an environment of self-care. The other thing you can think about is scents. So aromatherapy, the scent of lavender or citrus, or something like eucalyptus or rosemary, that can be invigorating. Something like lavender can be really soothing and relaxing. So depending on whether you're feeling like you could use a little bit of an energy boost, you might want to use something like a citrus or a rosemary. Or if you're feeling like you need to relax a little bit, you might want to use something like rosemary, but we'll talk about that a little bit more later. Okay, now this is by no means an exhaustive list. If you take a moment and think about where you hold tension in your face, you might want to just move your hands kind of along around your eyes, the jawline, particularly this area right here. If you're a clencher or a grinder, that would be me. This area might be quite tight. The forehead, if you have eye strain, you might find in the afternoon you're having a little bit of a tension headache right above the eyes. This is the time of year when we have seasonal allergies. So you may find that below the eyes, your sinuses below the eyes are a little bit tense. This is very personal. There's some key areas that many people hold tension, but you just think about where your kind of your sweet spot is. And I'm going to start here with the bony landmarks. And I just love the skull. I just think it's so cool. There are, I don't know if is my pointer working? Can you see my pointer as I move it? Yes, excellent. So if you look here, the diagram on the right, you see these little holes here right under the eyes. This is one of the access points for your sinuses. So if you are a person who has sinus pressure, this area under the eyes might be quite tender. So this is an area you might want to think about when we do our little trail map. If you have tension headache, sometimes there's tension in the temples around the lateral part of the eye. And there's this big sort of divot in here where a lot of tension headache is stored. And so applying pressure in this area is a really key zone for those who might have tension headache on the side of the head. And then finally, I want to point to this area right around the jaw. So this is a really complex area. The jawbone and the muscle that opens and closes the jaw is basically pound for pound the strongest muscle in the body. And so if you're someone who clenches or grinds when you're having tension, this area, because the muscle is here and it goes into the area around the ear, a lot of times ear pain or pain along the side of the head is going to be referred from the jaw. So this is an area to think about if you're someone who holds tension in this area. And this diagram, again, we're adding another layer. Now we're going to look at the muscles, same area. And you can see this area in the jaw, you've got 1, 2, 3, 4 different muscles that are intersecting. So you might have tension in the neck or the top of the shoulder, and that pain is going to be showing up in your jaw. There's a lot of intertwined and interconnected muscle fibers in the face, which is why massaging the face is so effective and it can feel so good. And then I want to point again, here on the side of the head, there's this big muscle called the temporalis, and this is going to be a key area for any kind of headache or tension in the side of the head. This diagram here on the right is basically our little trail map. We're going to be going around the eyes, around the ears, across the jaw, and then back up. And I just provide this illustration so that you can see how acupuncture points, which are all of these, the blue line, the white line, the green line, those are all acupuncture points and channels and key areas where we hold tension. So these points in here are points you can apply pressure to, which I would otherwise needle if I was doing an acupuncture treatment. But you can provide yourself with a really nice self-care acupressure session by using these same points. And this is just another illustration of how complicated the muscles are in the neck, the shoulders, and all going up to the face. So I wanted to just briefly touch on creating an environment of relaxation. So if you are using essential oils, you would never use an essential oil undiluted. So these are the things that come in like a little bottle like this. If you're going to be using an essential oil for relaxation, put a little bit on a cotton ball, or if you're having some challenges with sleep, you can take a little bit of lavender and put it on your pillowcase. And then that way you can inhale the scent at sleep time as you're trying to focus on relaxed breathing, and you'll have the benefits of that nice scent at sleep time. So use a diffuser, a few drops of an essential oil on a cotton ball, or dilute it in a carrier oil if you're going to be using it topically. And then listen to something. And this is, again, so personal. There, at the hospital, we have a relaxation station, which I have some patients who love it and some patients who find it really irritating. So I never assume what one person is going to find relaxing or another person is going to find relaxing or invigorating. So your personal taste will guide you. If you are wanting to do a little bit of massage for relaxation, so to alleviate tension, I would suggest using something like lavender as a scent. If it's like that 3 o'clock droop where you're pretty tired, you still got things on the list, and there's no time for a nap, you might want to use something a little invigorating. And that would be something like a citrus, a mint scent, Or rosemary is one of my favorites because it just kind of like just wakes you up. And this time of year, if you're having any sinus congestion, something like rosemary or eucalyptus is also going to help clear your sinuses. So we're getting ready for our demo. So if you want to take a moment to wash your hands, if you haven't already done so, make sure you wash your hands. Use anything you use around the eyes. Make sure that you use a lotion or an oil that you know is gentle to your skin. And we're gonna be working around the eyes, but try to avoid the immediate area around the eyes. Definitely less is more, and I think that's frequently one of the hardest messages to convey. That I think many times, like, the more is more is the kind of the way to go. Like, oh, if doing this for 5 minutes is great, then doing it for 25 minutes is going to be even better. And for acupressure, that's really not the case. The beneficial effect is cumulative. So if you can do this for even a minute or two a day, but incorporate it into your routine so you're doing it every day, that's going to be better than doing it for an hour once a week. This is just something that your body has gotten accustomed to holding tension in a certain way and in a certain part of your body. And in order to unlearn that, you can give very gentle hints to the body to get back to a more calm and sustainable baseline. So it doesn't take a lot to do this. And the other thing I just wanted to mention is, because touching the face is really intimate, and even touching one's own face, especially if you're coping with a lot of tension and a lot of stress, it's really normal to have, I've had people tear up a little bit in sessions, or just feel like they're kind of getting welled up a little bit. That's all a completely normal reaction to touching the face, but also because the acupressure points have emotional as well as physical indications, you might have some sort of a gentle emotional release. You have a great team here to touch base with, but just to know that what you're coping with is profoundly challenging, profoundly difficult. And the momentum to kind of keep going is really strong. And anytime you pause to kind of take in the reality of how much stress you might have, it's a reasonable thing and an appropriate thing to have some emotion come up. So I am going to stop share so I can show my whole face. Okay. All right. And there's my whole face. Okay. So I am going to, just so you can see, I'm going to tuck my hair away, and I'm going to take my glasses off. And like Nori, I can't see anything. So I'm going to go like so. So the area where you're going to start is the midpoint of your eyebrows. So this is an area where you might have some tension from sinus pressure. It's a main acupuncture point, acupressure point for sinus pressure. And this is where we're going to start. I'm going to run through and talk you through it once, and then we'll go through it again slowly. Okay. But I'm just going to show you the points: middle of the eyebrow, top of the eyebrow, glide into the hole in the side of your head, go to the front of the ear. Remember those points in the front of the ear where the jaw inserts, and then dance around your ears, feeling that muscle above the ear, which might be pretty tender. Go to the back of the ear. From here, I like to take a little detour along the base of the skull, which again is going to be pretty tender. If your neck feels really tight, just gently extend. And then you'll feel that gap between the skull and the muscles. And then go right back. to the front of the ear and down to the jawline. And this is where you really want to take your fingers, take 2 fingers, and from the ear all the way down, just massage until you get right to this corner where the jawbone goes down to toward the chin. This is the corner where you're going to stop and just massage this area. It may feel extremely tender. If you find a spot that feels really reactive, just apply some gentle pressure, like so. You don't have to go in hard, just doing a little, and just hold it. And breathe into the area. You may feel it begin to release a little bit. But again, this is cumulative benefit. So you do a little bit, and then you do a little bit tomorrow. So you pause at the jawline, go back up to the front of the ear, and you're going to run right into this bone, your cheekbone. You're going to just dance along the cheekbone until you're back to your nose, and then back up to the eyebrow. I'm going to put my glasses on so I can see. Did that make sense? Yes? Excellent. Okay, all together now. There. Oh, and the finger you use, I don't know why I put my glasses back on. You can use your index finger. I like using the index finger because this is a smaller area, and you use that to dance around the eyes. Once you get to the jaw, using 2 fingers can feel really nice because then you can get it's a wider area. Oh God, it's really sore. And then you can just apply pressure here. And the same thing when you're in the back of your head, the 2-finger technique works really well. Okay, I'm going to take my glasses off. We'll do it again. Index finger, you start right in the medial border of your brow, so right between your eyes. And then you glide over top of the brow. These are all points that'll get your sinuses. And then glide, just follow your eyebrow, and you'll run right into this hole in the side of your head. And this may be tender. You can pause here, just a little bit of pressure. 1, 2, 3. And again, this is personal. Direct pressure may feel better to you, or a little bit of massage may feel better. There's no right or wrong on this one. Whatever your body tells you feels good. Just do that technique. And then go down to the front of the ear, and you'll feel where that bone inserts. From here, you might want to go to 2 fingers and go around the ear. Ooh, feeling that muscle on the side of your head. Just follow the line of the ear until you run into the back and another big bone there along the edge of the occiput. So that's the base of your skull. Take a little detour along the neck, just massaging. The neck feels tight. Just very gently extend. This is flexion, this is extension. Just extend a little bit so you can really dig your fingers in there. And then back to the back of the ear, loop over to the front, that same area, and then again, same 2 fingers, glide down the jaw. And just pause wherever you feel a little bit of tension or a lot of tension. And either direct pressure or gently massage the area. Sometimes it feels good if you want to open and close your mouth gently. You can really feel where the tension is. You might end up spending a lot of time. I don't know if there are clenchers and grinders in this group, but as a fellow clencher and grinder, might spend a lot of time here. And after you've given this enough attention, go back up to this bone is called the zygomatic arch, and it runs right, or the cheekbone, it runs right along the front of your face. And that hole I showed you in the skull where the frontal sinus is opens up, you may find a spot that feels pretty tender. Just be really gentle in this area, especially if you're having some sinus pressure or some congestion. This can really open things up, but be very gentle. And then we're back at the nose, and then go up the nose to the medial border of the eyebrows where you started. Oh, that feels really good. How you guys doing? So this is something, doing this 2 or 3 times might take you, oh, I don't know, 10 minutes. But sometimes you're washing your face. What I like to suggest is you incorporate this into something you're already doing. So if you're washing your face in the morning or at the end of the day, and you're, doing this, and you're, just go along the bottom of the zygomatic arch, because maybe you're having sinus congestion, or you're feeling like you got a little bit of pressure. Washing your face, just pause here. Or same thing, washing your face, just spend a little bit of time massaging the jawline. Or if you're having some tension up here, you're washing your face, just pause, dance along the brow, and then just go into that point in the side. You can do whatever component of this feels like it's helpful. And wherever your baseline area of holding tension is, that's where you can focus. So it doesn't have to be in any particular order. Your go-to place in your body where you feel the tension, and that's where you can focus your time, however much time you have, whether it's 30 seconds, 10 minutes, this will work. Now, I just wanted to, I know we're going to do questions at the end. I just want to make sure there isn't anything that people might want me to address specifically about this portion before I go to the next section. Or should I just go, Nori?
I think it's either way. If anybody has any question regarding the segment we just did, you can put it in here. Otherwise, Irene's absolutely going to take questions at the end.
Okay.
So
Okay.
really,
So
I would say keep going, Irene, and then
I'm going to go back to my screen share.
Okay.
I love this diagram. Okay. So this is what we did. We started here. We went, I'll go up to here, around the ear, little detour back here. And then we went to the jawline, back up, and then this fabulous green line, which goes along your zygomatic arch, back up the nose to where we started. It's really, you cover a lot of territory with just a couple points. Okay. And now I'm going to go to, I want to just focus on the content and not on the talky part. So I had some research, and I think it's all very interesting, and I can definitely forward the slides to Nori if you want to learn a little bit of research about sleep and acupressure. But I really want to spend some time showing you the techniques. And these are the acupressure techniques for sleep are things for you to do for yourself, but also things that you can do for the person that you're caring for. And this is something I regularly do when I'm working in the hospital and working inpatient with patients who have insomnia. I use this technique a lot, and people find it very helpful. I also use it in when patients are getting infusion. If they're having a particularly stressful day, hand massage is just extremely, extremely powerful. So acupressure in the hands has a lot of benefits. The acupuncture points in the hands, and that would also mean the pressure points, are the strongest points in the hands are in the body are in the extremities. So that's the hands, the face, and the feet. And applying pressure to the hands can really help with improving nerve conductivity. If there's any pain in the hands, definitely lead to relaxation and greater well-being. And this is something that's really easy to teach someone else to do for themselves as well. So again, my washing your hands, we did that before. So I'm showing you this diagram because I want you to focus on every bit of your hand. So most of the times if you put hand lotion on, you just kind of do like this and you're done. What I'm wanting you to focus on is the hand from the wrists all the way to the very tip of the fingers. So we're going to be doing massage all the way from here to here. And very important to not ignore the tips, because again, the stronger acupuncture points, particularly for relaxation, are at the tips of the fingers. So you're going to want to have a really comprehensive approach. And then I have one pressure point I want to show you, which I'm just gonna, can people see my hand as I'm showing you with this hand? Okay, so you're gonna start on the pinky side of your hand. And you're going down until you get to your wrist crease. Now the wrist crease is that hinge. And it's a line which, if you're young, you have one. If you're older, you might have three. I have two, but you want to use the line that's closest to your palm if you have more than one line, more than one wrist crease line. So slide down the pinky side to the wrist crease and then move over the wrist crease. You're gonna run into a bone. It's very prominent. If it feels like it's hard to feel, just flex your wrist a bit and you'll feel that bump. And that is the point here. That's the bone is right here. And the point is going to be on the inside of the bone. So you're going to glide along the wrist crease and you're going to fall into a bit of a crevice. And that's the pressure point, which is really profoundly helpful for sleep. And now I'm going to stop share and I'm going to show you in the bigger picture. So I take a little bit of lotion. I have this giant thing of lotion. It doesn't have to be any special lotion, just something neutral that feels good on your hands. And I'm just lotioning my hands to just make it easier to do the massage. Okay, and we take the thumb and the index finger of the opposite hand, and you're just going to go and massage the palm with the thumb. And then when you get to the digits, the thumb and the index finger, and you glide all the way to the tip and give it a squeeze like this. Glide all the way to the tip, give it a squeeze. And then end with the thumb. And you can spend you can really dig in to the palm. And if you're spending a lot of time on the computer or your hands in this position, I know I've done this workshop with nurses, a lot of people who do physical caregiving, and they're in this position a lot. And so even just gently doing a counter stretch, if you're doing a lot of personal caregiving, is just going to feel marvelous. And that's where you want to take the thumb and really dig into the palm. And then gently, with basically the flat of the other hand, just give it a nice stretch. And you can hold this for 15, 20 seconds. You don't want to be pulling. You want to just remind your hand that it has a big range of motion. And when it's in this position, the fascia, which is this really tough connective tissue, it kind of gets fixed in this position. And you just like kindly and gently reminding it that it also can do this. And then take the thumb and gently pull it back. And you can even take, if you're doing this for someone you're caring for, so imagine this is somebody else's hand, and I'm just taking my hand and I'm just gliding to the tip. Just gliding, again, thumb and index finger gliding to the tip. Nice and slow. This is one of those techniques where you want to just have a nice bit of lotion in your hand and glide all the way down to the thumb. Give it a little bit of a squeeze, and you can do this multiple times. It's really relaxing, and just basically take the whole hand and just glide all the way down to the tips. If you're doing this for another person, you can have their hand resting on a pillow, like so. No, I don't have a pillow, but hand resting on the pillow. You can have it on your lap, just in a way that they're positioned as comfortable as possible, so that any, if, for example, you're working on someone who's lying in bed, you can have their pillow up, their arm up on a pillow, and you can just be sitting on the edge of the bed or in a chair next to the bed. It's a really nice thing to do the last thing when all of the other caregiving is done and you're kind of settling down for sleep, to put on some nice music, get a little bit of lavender, and then just end the day with a little bit of a hand massage. And same thing with the other side. If you're doing it for yourself, thank you, Jess, bye. If you're doing it for yourself, again, you take the thumb of the opposite hand and really be kind to your palm. You can really dig in there. And then thumb and index finger, glide to the tip, little squeeze. And then these kind of longer strokes. I need a little bit more lotion. It's really dry. These kind of longer strokes all the way to the tip of the finger. And if you have a little bit of, even a little bit of arthritis, just be kind around the joints. Just you can kind of glide over the joint that's a little bit uncomfortable and just get to the tip. If you have a little bit of, even a little bit of numbness and tingling, this can really help with improving circulation. It's just a nice technique. And then you can finish with a little bit of gentle pressure. And I mean really gentle pressure at this point. So if you finish the hand massage, and you can basically even just hold the hand or hold the wrist and just have the wrist rest on your finger. So you could have the person's hand on a pillow, and then you're underneath. You just go over that bone, and then you just hold it. And hold it for anywhere from 45 seconds to a minute. And you can do that once a night. The research was really interesting because it showed that acupressure had a cumulative benefit. So doing this technique once a night for, I think they did it for several weeks. So it was just part of a routine, but that people's frequency of waking and the amount of time it took to get to sleep were both reduced. So it wasn't like, it's not like taking a pill. So it's really something to add in addition to any medication you might be taking or anything that's prescribed. It's not instead of. It's something to add to your existing care package to optimize the symptoms. But it might take some time before you notice a change if you're doing the acupressure, because it is as I mentioned previously, you're kind of going from a way the body's learned to function, and you're kind of rewiring it a little bit. And that can take some time to get settled in. But the beneficial effects of all of these are cumulative. And I encourage you to try to incorporate this into something you're already doing, and to know that even if you have just a couple of seconds or a minute or two, when you're washing the dishes, you can just finish off the dishwashing. Oh, do people have dishwasher? I wash dishes. I don't have a dishwasher. But when I wash the dishes, you're just finishing up and oh, I'll take a little lotion and you're done. So something you're already doing and trying to incorporate this into your day is a really nice way to build it as a habit going forward. And I think that's it. I have time for questions. If anyone has any questions.
Yeah, if anyone has questions, feel free to put them in the chat. And if not a question, a comment, maybe any of your own experience with acupressure. So a question, a witnessing, we are open. Irene is open to this time.
Also, if you're finding, if you've used any of these techniques before, what could you go over the pressure on the wrist? Yes, the acupressure point. Absolutely. So I'm going to getting a prop, which is my little. I'm going to get a little beach towel here, and so how can I do this? There we go, like this. So if you're doing it for someone else or doing it for yourself, is that, why don't I show you for yourself first? You find the point by going to the pinky side of your hand and gliding down until you get to the wrist crease, which is the hinge here. And when you get to the intersection of the hinge and the pinky side of your hand, you're going to glide over the wrist crease. So go over that hinge and you'll feel a bone. And this is the pisiform bone. So on the inside of the bone, you're going to go glide past the bone and you're going to fall into a divot where the bone ends, and that's where the point is. And to apply the pressure, you can use, if you're using it for yourself, one of the things I like to use is the eraser end of a pencil, because it's kind of, it's a challenging point to find sometimes, but if you take the eraser end of a pencil and you can just hold it, and it's a really great way to apply pressure in a gentle way without having to dig around with your nail to make sure you're in the right spot. The eraser end of the pencil will get the region really nicely. So you can just hold it like that. And this is something you can do if you're, I don't know, if you're sitting at the table at the computer or reading the news or watching television, you can just do this for 30 seconds to a minute. And then if you're doing this as a caregiver, you're going to have done the hand massage. And again, the point location is the same. And if you're doing massage and you're getting familiar with the anatomy of the hand for the person you're caring for, you're going to notice this bone. I mean, the bone is really prominent. And when you're done with the massage, you can just hold the hand and glide over and just hold it as you hold the wrist. So this is the position I'm in. I've got my hand in there at the point, and then hold. And it's a way you basically applying the pressure and doing an acupressure session when it will feel a lot like just a gentle hold of the wrist, which is why I really want to emphasize less is more. So very gentle pressure, no need to use a lot of pressure on the any of the acupressure points or the massage.
Irene, we have, thank you. Irene, we have someone who asked a question. Do you have any techniques for back pain?
Oh, back pain is a complicated question. So I would first rule out any structural or anatomical, and I'm assuming that this is just sort of outside of any kind of medical condition, like any kind of disc issue. Of course, that would have to be dealt with your medical provider. But if you're having sort of fatigue, long day fatigue, the back is feeling a little bit sore, a little bit tired, one of the best things is a yoga position where you just find a comfortable spot to lie on your back and put your knees up. And that takes a lot of the strain off your lower back. And I would, of course, rule out any kind of physical problem first. But a lot of times, again, because posturally, we're all anteriorly rotated. So caregiving, leaning over a bed, being on the computer, everything is forward. And one of the kind of things you can do for your back, and it's very similar to what I showed you for the hand, is that you take a technique that does the opposite of what your body has been doing all day. So if you've been leaning forward, anteriorly rotating, so all of this is forward, the nicest thing you can do is to find a nice flat surface, put a very small pillow to protect your neck, and just let your back relax in the neutral position. Because when you're caregiving and anteriorly rotated, you're not in the neutral position. Your body puts a ton of strain on your neck, on your shoulders. This area will get really tight. And it's kind of an unnatural position, but it's one too many of us are frequently in most of the day. If you're sitting at a computer, if you're leaning over a bed, if you're even leaning over, if someone is in a recliner and you're leaning over, you're putting a ton of strain on your back. So I think doing that simple technique is going to be a really nice thing to do for yourself. And it's if you bend your knees so that you're lying flat and you have your knees bent but the feet flat on the floor, that will flatten your back out and that'll take any strain off of your back. But make sure that nothing else is going on too.
Thank you, Irene. Yeah, that feet flat on the floor, knees up. I want to do that after this program.
Yeah.
We have Joanne has asked a question. She said, "Can we use hand massage techniques on the feet?"
Yes, absolutely. And it's a very similar technique because you just have more, and the toes are short. You have more of this part than the toes. I would have shown you the foot technique, but it's kind of difficult to do in this setting. But I actually, Nori, a colleague of mine has a very short snippet of video of foot massage technique. Can I send that to you, and can you forward it to the group?
Yes, if you could send me that and these slides, and I have everyone's email address, so whenever you send it to me, I can get that out to everybody. Absolutely.
Because the technique, my colleague Michael, who's a massage therapist, did this great. I'll get a copy from him and I'll send it to you. But it's basically using the same technique on the foot, but those long strokes. You start at the middle of the foot and then just pull to the toes, and then just give a little squeeze. Is phenomenal. It's a very similar kind of technique with the feet. What you want to be careful of is making sure the skin is intact. If there's any fungus on the nails or any area of a plantar wart or anything, you want to make sure you wear gloves if you're working on the feet, just to be careful. And also, if the person you're working with has any kind of peripheral neuropathy, so numbness or tingling, just make sure that you check out, it's a good opportunity to check the nails, just to make sure the nails are nothing's digging into the skin. It's a really good idea to take a good look at the feet periodically, especially if you're a caregiver. But the technique is very similar.
Fantastic. Judy's got her hand up.
I have my hand up.
Judy.
Questions of, are there points for energy? You did points for sleeping, but are there some points for energy? And are there also some points if someone is nauseous?
Yes. The nausea points are, and I can again send to Nori a little bit more detail. We could just do another session on acupressure too. But
I'm not going to say no.
The
energy? Oh, nausea.
the energy. Energy, I like to do the facial technique, but using a little bit more vigor. So rather than using a gentle technique, just trying maybe a little bit more pressure. And I think the scent issue can be really helpful. So an invigorating scent, like taking a whiff of rosemary or eucalyptus, can be really helpful for fatigue. But I also must say that we are a chronically sleep-deprived world, and sometimes a nap is the answer. And I'm a big napper. I'm a big fan of naps, even if it's a 10-minute nap, that it really does allow the body to reset. And I'm kind of an ambassador for the nap.
I love that. Irene is also a nap ambassador, among many other things.
I just think the importance of sleep, we are learning. There's so much newer research about the importance of sleep quality and quantity, and that the idea that sleep is wasted time is just infuriating to me, because it's so important for all of your physical functions, for digestion, for the body's restorative functions, for I mean, it's just vital. So make sure you're getting enough sleep.
I thank you so much for plugging sleep again, because it's a little bit counterculture, and you know, even with absolute respect to Judy's question of, you know, how can I get that energy hit?
Yeah.
Sometimes you just need to rest, and I have nap envy because I'm not a good napper. But my friend recently said to me, you don't have to fall asleep. Like a nap can just be a quiet time to rest. And a few months ago, we did 2 yoga nidra sessions. Again, you might not be asleep in this idea of I have to go to bed now. But there's a different way to rest. So thank you for reminding people that resting is of great benefit.
Well, and it's not an on or off switch. There's a dimmer switch, that it's not sleep or awake. That rest is a really important concept. And just Judy, I sometimes will also just squeeze my earlobes when I'm feeling tired. Again, the ear is a microsystem, and so just taking the edges of the earlobes and just going all the way from the tip, and not hard, but just sort of gently pulling them all the way out. I find that really invigorating.
Yeah.
Because it's very vascular, and you just get the blood flow going to your head.
Thank you. Irene, I don't know if we have 1 minute. Does anybody else have any other last moment questions?
This was fun. You guys are great. I want to see everybody. I just want to get the right view.
Stephanie says, this has been great. Somebody said, do you have a tip on regarding nausea? If you had
nausea, that's right. There is a pressure point, which many people know of as, there's a product called, used for seasickness. There's a point on the inside of the wrist, and many people are familiar with this product or this point from seasickness. So let me just do a speaker view very quickly. So again, we go back to our friend, the wrist crease. And each of us has these very ropey tendons on the inside of the wrist. If you run your hand along the inside of your wrist, you feel those tendons are really ropey. And if you just gently flex, you'll feel them a little bit better. So the nausea point is between those tendons. And you might have very tiny space between them, but you'll feel a space between the tendons. And it's about 2 inches up from the wrist crease. So you can take your thumb and be your own measuring stick. So 1 thumb, 2 thumbs, and then slide over until you're between between the tendons, and that's the point for nausea. And again, bilateral. So the hinge, your wrist crease is your landmark. You take the thumb of the opposite hand, lay it along the wrist crease. 1 thumb, 2 thumbs, slide over between the tendons, and that's the point. And you may feel a little bit of, if you're having nausea, or if the person you're caring for has nausea, it may feel a little bit tender. Hold the point for about 30 seconds. And I found this point to be really effective as a bridge. So if you have anti-nausea medication, take the medication and then apply the pressure to just kind of take the edge off a little bit. And my dog just started barking on time. It's crazy.
Okay, your dog knows it's 2:01.
I know.
Just want to say thank you so much for joining us today, for
This
providing
is
an
great.
additional support for everybody here. I will have to say, everyone, the evaluation is probably going to be in your inbox in a minute. So if you could take the time so that we know what's important to you, how this has been of benefit, anything else you might need. Keep your eyes peeled for Health and Resiliency the next few months. Some dates are to be determined, but we're going to have these wonderful poets who are going to give us a 3-part series, a writing series on using our creative writing. It doesn't mean you need to be a poet, for a catalyst really for healing and processing our emotions. We're going to have a great music program coming up that is exciting. We're going to have another movement program coming up. So keep your Thursdays at 1 o'clock for Dementia Care Collaborative's Health and Resiliency. Irene, thank you again, and thank you to
all. It was so nice to meet you, and I wish you all the best. Take really good care of yourselves.
Yeah. So thank you for choosing to take care of yourself in this hour. It's on the dementiacarecollaborative.org website soon. I say 7 to 10 days, but you can check out our other videos there now. All right, everyone, have a good afternoon. I hope you
Thank you.
enjoy the day.
Thank you.
Thank you.